coronavirus pandemic continues to spread across India, the centre has shared a list of risk factors for patients with hypertension, diabetes and heart diseases. Are patients with heart disease, diabetes or hypertension at an increased risk to get coronavirus? No. People with hypertension, diabetes or heart diseases are at no greater risk of getting the infection than anyone else. Among people with above diseases, is there an increased risk of severe illness or complications once infected? The majority, about 80% of people diagnosed with COVID-19 will have mild symptoms of a respiratory infection, a fever, a sore throat or a cough and make full recovery. Some of the people with diabetes, hypertension and heart disease, including heart failure, which is a weak heart, may develop more severe symptoms and complications. Therefore, extra care is advised for these patients. Well, are people with diabetes more prone to COVID-19? In general, you know that people with uncontrolled diabetes are at increased risk of all infections. People with diabetes are not at higher risk for acquiring the infection, but some individuals are prone to more severe disease and poorer outcomes once infected. So when diabetic patients become sick, they may require frequent monitoring of blood glucose and adjustment of drugs including insulin, small frequent meals and adequate fluids. What can you take when you experience pain or fever then? Some type of painkillers called NSAIDs like ibuprofen is found to worsen COVID-19. Such drugs are known to be harmful to heart failure patients and may actually increase your risk of kidney damage. Avoid these NSAIDs or take them only when prescribed by a doctor. Paracetamol is one of the safest painkillers to be used if required. What about reports about BP medications then increasing severity of COVID-19? Currently, there is no evidence that the two group of drugs, which is ACE inhibitors, example ramipril, enalapril and so on, and angiotensin receptor blockers or ARBs, for example losartan, telmisartan and so on, increase the susceptibility or severity of COVID-19. These drugs are very effective for heart failure by supporting your heart function and controlling high blood pressure. It may be harmful to stop these medications by yourself. This can worsen your heart condition. Some tips for those with diabetes, hypertension and heart disease is that make sure you take all medications prescribed regularly as before, even if you are mildly symptomatic. Continue to talk to your doctor. Don't stop any medication unless advised by a doctor. Continue with your blood pressure, diabetes and heart disease medications. In case you are unable to visit your doctor, medications to control cholesterol should be continued. Avoid smoking and alcohol. Follow your diet and exercise. Test your sugar levels as frequently as you can so that you can keep your diabetes under control when you are COVID positive.